In Dr. Oswal's clinic in Pune. Dr. Oswal has been helping people from all over the world the last 30 years in his life. He's dedicated his life to people with brain disorders, and he has achieved a lot of things, and also obviously a lot of love from so many people as well. Now we are with you from Mauritius, and initially you came here like a year ago.
It's my own child.
How old is she?
She has 6 years.
6 years. How did you first find out about G therapy and Dr. Oswal?
So, from a friend referred us to come to meet Dr. Oswal because she was here 1 year before.
Okay.
Yeah.
So, before you met Dr. Oswal, what kind of things you have tried for your child?
We have seen many pediatrics in Mauritius and special schools, speech therapists, and some OT, occupational therapy.
Almost everything.
Everything that we can do.
So what was the result with everything that you tried?
Yeah, the result was she was developing very slowly, not. She was developing very slowly there, but with between this years means. Oui, papa, because anglais là.
Hello.
Yes. Yeah. She doesn't understand what we are saying.
But she's happy.
Yeah.
So please share with us. I mean, when you came here first, it was last year. So what happened? You met Dr. Oswal. So what was the process? You explained to him,
Yeah, we have explained all the problems that she have.
Yeah.
Yeah. As you can see, there is a list of problems that she has last year.
Speech problem, balance problem, no jumping,
poor development.
Yes. Right. So you've been using G therapy almost now a year.
1 year.
1 year.
Yeah.
So please tell us what kind of development your child has been showing.
Yeah, for the between the last year and this year. She has got more balance. Yeah, she was not climbing staircase, etc. But now she climbs staircase.
Oh, amazing!
Yeah, stairs.
So you will carry on G therapy?
Yeah. We are. That's why we are here now. Last year we were
here. So you came from Mauritius this time again?
Yeah, this time again. This is our second time.
Okay. So Dr. Oswal, I want to ask you. When you initially last year, saw the child, she was 5 years old, now she is 6 years old. So, I mean, was she a difficult case, or, can you please tell us about?
Yeah, she was having a severe developmental delay.
Yeah.
There was no balance in while walking also. She was unable to walk unaided. She was unable to climb the stairs. Understanding was less. And then hand flapping was there. She had some behavioral issues also, like biting others, banging the head, which has reduced drastically in last 1 year.
Okay.
Yeah, and G therapy works without sedating the child, and the child's understanding has improved. You can see now the child is interacting with the parent.
She understands well.
Yeah, and she's interacting with the parent.
Yes, interacting, and then she can climb stairs. Hand flapping has reduced. Head banging has reduced. She used to bite herself, that has been reduced, and so that is a very big change and a good quality of life she has achieved.
So from now on, I mean, her therapies will be still the same, or you will change the therapies?
Yeah. Now she is about 6.5 years old now.
Okay.
So as she will grow, and if the new problems pop up, we will try to treat those also.
Oh, it's amazing, amazing. So her life quality will be better.
Yes, definitely. And she has improved in trying to understand more words now. So she is more communicable, more social now. That's a very big change, which no other treatment in the world can improve the understanding level or the cognitive functions of the brain, which G therapy is doing.
Now I've seen some amazing, results here, and it's just, beyond words. So I mean, I think humanity owes a lot to you, over the years. So you have tons of patients and people from all over the world, and you deal with everybody like with the same passion, same love and care. How do you keep everybody you remember about everybody as well? How this possible?
We keep a we have a very nice protocol.
Yeah.
So we try to understand from the parents what are the present problems for which they need our help, and accordingly we prepare the medicines.
Okay.
And everything is ready with us.
Also, what I am wondering with how you are communicating with Dr. Oswal, because I know that you are so punctual and you are not somebody you just give the medicine and people go. You are always helping, asking and everything. So how did you find that, with Dr. Oswal, because he's so caring also?
They send the report by WhatsApp and by the
Yeah.
Yeah,
And
by
then he
WhatsApp
follows.
and mail, etc. Yeah.
Okay.
Even we call also.
Okay.
Yeah.
So I mean, what was her name? Your child's name?
Ipsha.
Ipsha. So Dr. Oswal, with Ipsha, if we see her, let's say, in 3 years' time, what kind of developments we will be expecting to see in her?
She will become more and more independent. Yeah, that's the goal of our treatment.
It is important, very important.
Yes, to make her more independent in life, to improve her cognition, to improve her balance, to improve her speech level, to improve her understanding, to understand more language. So in life she becomes more independent, which was not there till 5.5 years age. And that has improved just in 6 months, and today we have completed 1 year. So that's a very big change.
That is amazing. That is amazing, Dr. Oswal. Dr. Oswal, I mean, with G-therapy, we see lots of improvement in many departments, but also cognition is very important as well, and especially like in her case, we can see she's very independent. So how do you do this? I mean, it is major.
Yeah, there is no treatment available to improve the cognitive functions in the brain. And G-therapy has shown improvements in almost more than 20,000 children. And it improves emotions, it improves cognitive higher cortical functions, it improves the speech, thereby the child becomes more and more independent. And motor improvements, you can see she was not at the age of 5.5 years when we started treatment, she was not walking without help, unaided. She can walk now unaided.
She can walk, yeah.
She can climb the stairs, she understands more words, so she is becoming more and more independent in life. That is a very important factor for G-therapy.
And there is not, medicine like this,
Yes, no medicine to improve the higher cortical functions of the brain. And G-therapy has shown persistent results in more than 20,000 children. And in children with developmental delay, cerebral palsy, autism, Down syndrome, and in stroke patients, irreversible brain damage cases. Even in irreversible brain damage cases and in degenerative brain conditions like subacute sclerosing panencephalitis, it has shown that the child from third stage has gone to second stage and has improved. So that is a big objective evidence that G-therapy is working. Otherwise, SSP, subacute sclerosing panencephalitis, is a fatal disease, and it is a progressive disease. But after starting G-therapy, more than 70% of the patients have shown cognitive and clinical improvement.
That is amazing.
Yes.
You must be, very proud, when you see.
I'm proud because it is helping a large part of humanity.
Yeah, that is. Yeah, we are very proud of you as well.
Thank you.